Hello, I am Calum Williams. I am a postdoc here in the Department of Physics at the University of Cambridge. This is my talk titled Shedding Light on Cancer Towards Bespoke Snapshot Spectral Imaging. So firstly, just an overview, I am a postdoc within Professor Sarah Bontique's group here in physics in Cambridge, and our mission statement is to advance our understanding of tumor evolution through next generation imaging sciences. We do that in a variety of different areas, including a variety of different techniques, whether that be optoacoustics, multi-hyperspectral endoscopy, all the way through to first-in-human clinical trials. So a range of research areas undertaken by a range of different researchers, whether they be chemists, biologists, engineers, or physicists like myself. So our general motivation here is early stage cancer detection. And as kind of highlighted by this graphic here, just on the left, cancer survival rates are typically much, much higher if diagnosed early rather than its late stage. And the problem with that is that by doing so is actually challenging. It is difficult. One such area where it's difficult is esophageal cancer, in which the gold standard, or the standard of care, is white light endoscopy. So finding contrast between different tissue types is very difficult. And the reason why it's difficult is that we're normally trying to detect these very subtle changes in disease development through something which has only been developed to mimic the human vision system. And the human vision system has not really been set up to be a good differentiator of different tissue types, and it makes it very easy to miss precursor lesions or dysplastic tissue. And the kind of motivation for all this is that, can we do better, right? Can we do better than this, right? And could we potentially use different optical biomarkers here in order to reveal different properties about the tissue and to be able to differentiate between different tissue types? So there's a nice or a lovely review by Dale Waterhouse here on the potential for different optical biomarkers to be used here in the clinic or a different imaging system, and it highlights the fact that, well, if we use different properties about the light that are reflected or scattered from the tissue, so whether that be the polarization of the light state, whether that be through phase, whether that be through the absorption spectra of particular in particular wave bands, this can reveal different properties about the tissue itself and the abundance of different biomarkers. And the general point here is that this kind of information is lost with the state of the art. So a white light endoscope loses a lot of this information. And the other kind of useful note is that these spectral signatures can potentially provide this useful diagnostic information, and in particular the contrast, in order to differentiate between these different tissue types. And here is just to highlight more visually, if anything, the absorption spectra on the left here, or the fluorescence intensity on the right here, of different endogenous or exogenous contrast agents in the tissue itself. And monitoring these, or detecting and monitoring these, makes it potentially much simpler and more straightforward to monitor the disease development, or be able to differentiate between different tissue types. The nice thing about spectral imaging is, compared to other modalities, is that it can potentially be quite easy to apply to conventional endoscopic configurations, whether that be chip on tip or babyscope. So it makes it much more, say, cost effective and more straightforward to rapidly translate it into the clinic. The other nicety as well, the ability to co-register this information with white light imagery, which is the kind of imagery that an endoscopist or clinician is much more familiar with, compared to a Z-like scan or looking at the depth information into the tissue. I mean, the kind of gold standard, if you will, of spectral imaging is hyperspectral imaging. So the ability to capture the hypercube's worth of information, so very detailed spectral and spatial information about the object or tissue. This review here by kind of Clancy et al. Just highlights some techniques used in surgical spectral imaging. And the point with this from my side is that, well, yes, hyperspectral is wonderful, but it comes at a cost. And the cost is, it is slow, it's typically bulky, and it's typically expensive. Right? And the nicety with, say, multispectral snapshot imaging is that you have a trade-off between the spatial and the spectral information, so you have a reduced number of bands. But a snapshot is much faster and it's much cheaper as well than say, hyperspectral. But the problem with that is that there are a lot of redundant bands. And what you would typically buy off the shelf is a linearly spaced multispectral filter array. So by that, I mean the mosaic that sits atop of the sensor in order to spectrally discriminate the light. You buy a system which you have linearly spaced bands where a lot of that information or a lot of those bands are redundant. But we would like, targeted bands, or biomedically targeted images in which we could have particular, say, spectral bands sat at particular parts of the spectrum of interest to us. So, as an example of that, so we have a typical, say, Bayer filter that you'd find in your smartphone. However, if you wanted a particular imager that is targeted to, whatever, hemoglobin absorption spectra, it would need to look, say, something like this. Application 2 for another biomarker might need to look something like this, et cetera, et cetera, et cetera. Right. So we can buy these. It's gonna cost us millions of pounds, and we're gonna have to order millions of these things in order to make it worth our while. So they're expensive, they're challenging to fabricate. So we're kind of left in the lurch a little bit here, and we can only make do with the linearly spaced bands or linearly spaced multispectral filter arrays that one can buy off the shelf, which is not ideal. So what we've been working on is a kind of a more cost-effective and straightforward way of manufacturing these things. So what we do is we use a multi-layer grayscale lithographic process in which we convert the exposure dose of our photolithography equipment. We kind of convert that to different cavity heights. And the cavity heights control the center wavelength of transmission of one of our spectral filter arrays, or one of our filter pixels, sorry. So here on the left is just an overview of the process. So if this is our exposure dose, this then directly corresponds to this optical transmission profile here under the optical microscope. And then the equivalent region of that area looks something like this with an atomic force micrograph. So what we can do using conventional clean room fabrication equipment, we can do this on the wafer scale, and we can do this on the chip scale as well, in which we can very quickly and simply change our exposure dose mechanism. That then changes the height of our cavities, and that then controls the center wavelength of these spectral transmission profiles. And then we can do the readout imaging as well. So we're currently creating these kind of R&D multispectral filter arrays in which we have tailorable spectral properties with kind of in-house fabrication, both on the wafer scale and on chip. So what we do with a commercial collaborator is we take these monochrome sensors, we do the fabrication top of these, so an atomic force micrograph on the surface here looks something like this, and then we wire bond and do the imaging in-house as well. So we have these kind of customized image sensors in which, say, for sensor 1 looks something like this in terms of the spectral response. Sensor N or sensor 2 looks something like this, et cetera, et cetera. So we can do this quite rapidly and quite cheaply at the moment. So what we're doing is the imaging as well. So we can do the kind of this is just a video of one of the image sensors being used to perform some basic kind of imaging here. So this is all kind of done in-house. So we have our kind of raw information, raw intensity information. You can see the mosaic atop of this. This is just zoomed in this raw image here. So we can do the RGB reconstruction. And then, we can also have a look at certain things like the spectral angle map between certain bands, or otherwise look at the difference in intensity between different bands, et cetera, et cetera. So, we're in the process of scaling this up at the moment. But the point is that we're doing kind of this kind of custom or bespoke snapshot multispectral imaging with these kind of custom arrays with the target of kind of biomedical applications. So, I mean, just to wrap up, I guess, a discussion point, kind of the future direction, maybe for the session later on. If one does have the potential for these bespoke multispectral images for biomedical applications or otherwise, what would be the most desirable properties? So whether that be, all has to be extremely narrow spectrum, right? We have to have very good spectral discrimination. Do people care purely about just maybe near infrared coverage, whether that be, to detect ICG 800 or otherwise? Does it have to be, cost equivalent to smartphone sensors to be useful? Would it is the primary goal to still have simultaneous, white light imagery as well, etc., etc. But just to plant the seed really is what would be the ideal situation here, and that's just kind of a food for thought type thing. So just some acknowledgements here. So the PI of the group, Professor Sarah Bondique, and two particular mentions, Dr. George Gordon, now at Nottingham, and Dr. Dale Waterhouse at UCL, who has organised this event. And yeah, so thank you very much.